Richard Sagredo, an important exercise minimum of 4,000 steps, 1 or 2 days per week, was just identified in the study as a benchmark to help seniors live longer.
The study patients were also are less likely to develop heart disease, say studies authors.
The research, published online by the British Journal of Sports Medicine, examined not only how many steps older women take, but how often they reach their daily step targets across the weeks. American researchers found that those who took 4,000 steps on 1 or 2 days a week had a 20% reduction in the risk of cardiovascular disease and 26% reduction in risk of death compared to those who completed less steps. The study also found that it was the number of steps taken rather than any daily pattern of steps that was tied to the risk reductions, meaning even if they were distributed throughout the day and were not part of any single fitness program, the effect was the same. Tracking daily steps has become a standard exercise measurement for many people, as many smart devices keep count with ease. Physical activity stimulates bodily repair and maintenance, which is especially important as people get older. Researchers at Mass General Brigham, an integrated healthcare system based in the Boston area of Massachusetts, examined 13 40 and older women with an average age of 7.8 years old. The team compared their step counts over a 1-week period against their mortality and cardiovascular disease rates over the next decade to identify the benefits. Advances in technology have made it such that we don't really move very much, and older individuals are among those least active, said study senior author Professor Amin Lee. Because of today's low step counts, it's increasingly important to determine the minimum amount of physical activity required to improve health outcomes so that we can offer realistic and feasible goals for the public. The participants wore anti-graft into accelerometers to track their steps over 7 days between 27:11 and 27:15. For the next 10 years, the researchers monitored deaths and cases of cardiovascular disease among the group. The participants were sorted by how many days per week they achieved step thresholds or above 4,000, 5,000, 6,000, or 7,000. Those that reached 4,000 steps 1 or 2 days per week had a 26% lower mortality risk and 27% lower cardiovascular disease risk compared to those that never hit 4,000 on any days.
Reaching 4,000 steps 3 or more days in a week decreased mortality risk further to 40%.
Important exercise minimums. Israeli trained muscle is recognized worldwide as a marker of human health and a test for living to life among women that reach the higher step thresholds. Cardiovascular disease risk leveled out, while the researchers also noted that the health benefits seemed to be associated with the total volume of steps taken rather than how many days per week a particular threshold was achieved. They say that suggests that there isn't a better way to get steps for men with similar total volume of steps, either achieved by consistent steps throughout the week or sporadic steps in just a few days, has similar health benefits. Stories just like this, walking slightly faster can help seniors stay active longer, plus an easy way to measure steps per minute. I hope our findings encourage the addition of step count metrics to physical activity guidelines. Study lead author Dr. Rikita Hamia. If we can promote taking at least 4,000 steps once per week in older women, we could reduce mortality and cardiovascular disease risk across the country. Let your girlfriends know about this important minimum for disease reduction.